Have you ever wondered about the different ways doctors check for tuberculosis, especially when it might be hidden in your body? It can be a little confusing trying to understand what each medical test reveals and which one is right for you. Well, let's clear up one common question right away. A chest X-ray does not typically reveal a latent tuberculosis infection. This means that if you have latent TB, your chest X-ray will usually appear normal. The reason for this is quite simple. Latent TB means the Mycobacterium tuberculosis bacteria are present in your body, but they are inactive and not causing any symptoms or damage. A chest X-ray primarily looks for changes in your lungs, like inflammation or lesions, which are usually signs of active TB disease. Since latent TB isn't actively harming your lungs, there's nothing for the X-ray to pick up. Instead, when doctors need to check for latent TB, they relying on specific diagnostic tools like the TB skin test, also known as the Mantoux tuberculin skin test, or specialized blood tests. These tests are designed to detect your immune system's response to the TB bacteria, indicating exposure and infection, even when the bacteria are dormant. While a chest X-ray doesn't detect latent TB, it still plays a vital role. If a latent TB infection is suspected or confirmed, or if you are experiencing potential TB symptoms, your doctor will likely order a chest X-ray. This is done to rule out active TB disease, which is when the bacteria are multiplying and causing illness. In cases of active TB, the X-ray can show specific patterns or abnormalities in the lungs that guide further diagnosis and treatment. Think of it this way. The TB bacteria, when latent, are often walled off by your immune system in tiny protective structures called granulomas. These granulomas are usually too small or subtle to be seen on a standard X-ray, unless they calcify significantly, and even then, it is not a direct sign of active latent infection. Therefore, a clear chest X-ray is good news because it indicates no active disease, but it doesn't give you the full picture about potential latent infection. Understanding the specific purpose of each diagnostic tool is key to managing your health. If you are concerned about potential TB exposure or have been advised to get tested, remember that dedicated skin or blood tests are the accurate way to diagnose latent TB, while an X-ray helps confirm or rule out active disease. Always consult with your healthcare professional to ensure you receive the correct evaluation and peace of mind.